Hi, my name is Sam, and this is my presentation on the movement to home care. So we all know healthcare is a constantly evolving and changing field. There's a lot of evidence that shows that this trend towards home health or home-based healthcare is going to continue to grow and will be a big part of healthcare in the future. I chose this field because I currently work in home health as an RN case manager. I also worked in home health as an LPN. I really enjoy this field and think that it's just very interesting and very beneficial for patients. By the end of this presentation, the learner will be able to differentiate the difference between home-based care and skilled home health. They will be able to identify one influencing factor in the trend towards home-based healthcare, and they will be able to identify one way the expansion of home health services impacts society. So what is home health? There's two terms I wanted to talk about. The first is home-based healthcare. This is a very broad term. It refers to both skilled and unskilled services. So this could be something like having a personal care aide who helps with bathing and meal preparation, but doesn't really do anything medical. But could also include services that provide, nursing or physicians that come out to the home. The other term is skilled home health. That's the field that I work in. And this sort of home health is provided by licensed clinicians, and there's a skilled service that is being provided. This is generally covered by Medicare as long as the services are skilled and the patient is homebound. In this case, homebound just means that there's like a taxing effort to get out of the home safely. Skilled home health is generally short term, so it'll be for like wound care, IV antibiotics, education, things like that. Nursing practice in home health is a bit different than it is inpatient. Nurses in home health have a lot more autonomy. Care is based off of their assessment because they're the only ones in the home seeing the patient. There's also a need for really advanced technical knowledge with different DME. Often the manufacturer of, say, wound vacs or IV pumps or the chest tube drainage systems that are in the home are based off the patient's insurance. So there has to be an understanding of all different models and makes of these items. Again, and similar to that, there has to be a diverse skill set. One visit may be wound care, the next could be education, then you could have a transplant patient. There's just a ton of variety in the day. These nurses have to have a very strong ability to coordinate care and navigate the healthcare system. There also has to be an ability to communicate and educate. And probably most importantly is adaptability. Home health is absolutely wild. You have no control over the environment that you're going into, so you have to just sort of be able to work on the fly. Home health also is really beneficial because you're seeing the person in their home environment and you can tailor care to their specific situation. So they're getting, realistic treatment plans, etc. So just being able to adapt quickly is crucial. This shift to home health is impacted and influenced by a lot of factors, and then home health impacts healthcare. So home health is reshaping how and where healthcare services are provided. It's taking care out of the hospital and into the community. Home health is very financially beneficial for both the consumer and the hospital. On average, a recent study found that home health decreased overall healthcare costs by about 38% when compared to like a patient with similar issues staying inpatient. There's also a significant decrease in hospital readmission rates, particularly in the first 30 days from their hospital discharge when people are sent home on home health services. This decreased rehospitalization means that there's more room in hospitals for planned procedures because beds aren't being taken up by people who are acutely ill. And these planned procedures like joint replacements, things like that they make more money for the hospital. So it's beneficial for the hospital. Similarly, home health has a lot of impacts on society. Home health contributes to patients and families that feel empowered and engaged in their own health care. It helps people come up with treatment plans and solutions that actually work in their life and their lifestyle, and are just like realistic goals. Um, Home health offers increased access to health care for underserved populations. This could be because of their location, like people who live in very rural settings and just don't have medical facilities around. This could also be related to a patient's mobility and just inability to safely exit their home. And of course, finances always play into this. So, patients may not have access to transportation or the ability to pay for transportation. Increasing access to healthcare obviously just improves community health. Home health also promotes a patient's ability to age in place, which is very important to people. It helps with their satisfaction in healthcare and just their overall quality of life. Home health has been shown to increase the likelihood of patients dying at home with hospice services rather than dying in a hospital from an acute exacerbation, which again is something that's very important to people. And overall, there are just improved patient outcomes and satisfaction. Patients who have home health rather than a hospital stay generally have lower rates of pressure injuries, falls, and infections. By now, you should have a pretty good understanding of the difference between skilled home health and home-based healthcare. You should be able to name one factor that is influencing the shift towards community or home-based healthcare. And you should be able to identify one way that home health is beneficial for the community at large. As healthcare continues to evolve and change to provide more patient-centered, safe care, we will undoubtedly continue to see this shift towards home-based healthcare.